You know, America has some of the finest doctors and clinics and hospitals and researchers in the world. But we pay far more for healthcare and get poorer overall health outcomes than any other developed nation. That makes no sense. You know, our healthcare programs were already in need of reform, badly in need of reform, when Congress voted for another 1-2 punch to our healthcare last summer, the ironically named One Big Beautiful Bill. That bill eliminated the tax credits for the Affordable Care Act, which made health coverage available to so many middle-class people. It's already hiked healthcare premiums by at least 75% this year. For so many people, the cost has tripled or even quadrupled. They're dropping coverage. That bill also includes drastic cuts to Medicaid that'll kick in when? The end of this year, after this election. And those cuts are going to reduce or eliminate coverage for thousands of families and seniors, children, and disabled individuals who rely on Medicaid-funded programs like Badger Care here in Wisconsin. When all of these hits land, over 270,000 Wisconsinites will have lost insurance coverage. And every one of us Wisconsin taxpayers will end up footing a $284 million bill for increased health care costs. Well, in addition to that, the loss of patients is going to cause more closures of rural hospitals, loss of providers in rural areas. This is going to reduce access to health care for everybody, regardless of where you get your coverage. You know, if government does one thing, it ought to make our lives better and it ought to make our communities more prosperous. But under this Congress, so many of us will simply become sicker and poorer. Here in the wealthiest country in the world, there is simply no excuse for that. In Congress, I'm going to support protecting, expanding, and strengthening Medicare and Medicaid, and ensuring that dental and vision and more mental health care options are covered and more people get coverage. We need to provide a public health care option that's available for everyone. That's abundantly clear right now. And the government needs to control drug costs in a meaningful way by requiring Medicare and other programs to negotiate with drug makers. Finally, we need to pass legislation to ensure access to a full scope of maternal and reproductive health care for all women and codify that in federal law. You know, there's no reason that here in the wealthiest country in the world we should have to live with the most expensive health care that leaves millions of people without coverage, while insurance companies and drug makers enjoy record profits. We can do better, and we have the resources to do better, and we have to. And I want to be part of a Congress that makes those changes on behalf of all Americans.